My name's Chris Hansen and I'm a professional squash player. I've been playing squash since I was 4 years old, and I was lucky enough to play at Dartmouth College for 4 years. I graduated in 2013 and immediately went on the professional squash tour. It was always a dream to join the professional tour after college, so I couldn't have been more excited that summer to get started.
We've worked with Chris in various ways along the way. We've dealt with acute injuries.
My first month in, I strained my hamstring and immediately was off the U.S. team. Didn't get to participate, and it was pretty devastating. I think mentally was the hardest part for me. I was thinking to myself, what do I do if I don't play squash? I had never considered that option. I had other people ask me what I was going to do when all I wanted to be focused on was getting back on court. So I was honestly having this, fight with myself. Can I play versus, should I just be finding another job?
Athletes come to us in two situations. So the first situation is an acute injury. So I've injured my ankle, I've injured my hip, whatever that problem is. And we need to deal with that, and we need to put that fire out. And then we also need to address anything that may have helped contribute to that. The other time that we see athletes is when athletes, they have long days of training, they're on the road a lot, like those types of situations as well. So on that situation, it's not so much about the injury, but helping them recover. So help them sleep better, help them feel better, help them move better, and just general reduce anxiety and stress and those kind of things as well. And that's really important because those will contribute to sleep and recovery components that are less obvious because they don't hurt so much.
I had been living in the area, and I had a lot of friends from when I was younger who had said, you got to see the guys at Greenwich Sports Medicine. And I had been one of those people that I was like, okay, I'll get there eventually. But the sad part is it took me getting this injured and having my career in jeopardy before I took them up on it to go see them. So I said, these guys, they're the only ones that can help me, and I got to do it.
By him actually trying to play without getting treated, because on his way to the tournament he went there, he started to get more symptoms. He started to see issues with his gut and with his digestion, and a multifaceted kind of injury.
From the moment I walked in, I knew these guys were the best, not only from the other sports that they had worked with, but I went in and one of the first things I saw was that they had worked with professional squash players before. And that immediately made me feel, that sense of almost being at home. These guys know what I'm going through, and they're going to be able to help me get to where I need to be.
With patients, we always want to address injuries from top to bottom, so we want to be preventative. So any injuries that, in the future, so that's range of motion, those kinds of things that we want to address and make sure they're optimal. Other things, sometimes people come in and they have a history of injuries that they've been dealing with and may not be so obvious to them, so an old ankle sprain, an old knee injury. And so now that range of motion is limiting another joint's range of motion. Say the knee is starting to contribute to a hip problem, and so we want to address both of those as well.
So my injury, I think, ended up being a blessing in disguise, because when I went in there to initially get evaluated, not only did they look at my injured area, they took a completely top-down approach and looked at all of my mechanics and found tons of problems, right, that I didn't know about. I had gone through juniors in college, not really focused on injury prevention, and they immediately were able to pinpoint so many areas that could not only help my hamstring, but help prevent anything in the future and really get my career off to the right start.
At first, he was scared, and he had a lot of anxiety and a lot of psychological deficits from the injury. But by encouraging him and enforcing that this isn't permanent, that this is going to get better, he was able to follow our instructions, get treatment regularly, multiple times a week, change his diet, change his pattern of what he was doing, and it allowed him to heal very quickly.
So during my injury treatment, I think a huge role that Greenwich Sports Medicine played was not only treating the injury while I was there, but also giving me the plan for the next few months and saying this is a treatable thing if you're patient and do the right things. And that's something that nobody was really telling me up to that point. Squash is a tough sport, and I've had other injuries since then, and every time I've sought Greenwich Sports Medicine for my treatment, my planning, and everything that would help me get back on court.
We were able to change him back to healthy gut pattern, healthy nutrition, and optimizing his performance.
I think the importance of injury prevention and going to the right people, specifically this team at Greenwich Sports Medicine, has allowed me to not only pursue my dream of playing professional squash, but in the last 2 years I won 2 back-to-back U.S. national championships, which I had never really thought I would achieve, right? And that stuff is only possible if your body is at its maximum ability to perform, and this is what these guys do here.